Dear students, today we are going to talk about the OSPE exam. OSPE exam, a very important part of your prof exam. However, this is the most ignored part of your exam because the OSPE exam is held on the same day of your Viva exam. So naturally you are much focused and worried about your Viva exam. For that reason you are not really focused, or you do not give enough emphasis on your OSPE exam. Now things should not be like that. Yes, you have the Viva exam, which is the most terrifying of the whole exam. But if you take preparation in advance about your OSPE exam, you can be much more relaxed during your OSPE part of the exam, so that you can do well in your OSPE exam. So without further ado, let's start our OSPE demonstration. Let's see the marks distribution. There will be 8 stations and 5 marks in each station, 2 minutes for each station. Total marks will be 40 for your OSPE exam, and total time allocated is 16 minutes. Okay. Now let's see the stations. What are the stations? There will be 8 stations, as I have mentioned above. First, there will be a procedure station. Okay, a procedure station. Then you will have an interpretation. You will have a prescription criticism. You will have 2 static questions. One question from term 1 and the other question will be from term 2. You will have a device identification, a drug formulation, a clinical scenario, and a procedure station. Well, procedure station I have mentioned above, so these stations will be given. Alright, now let's talk about the procedure station. Well, there will be 2 procedures. You can see here there will be 2 procedures. One will be a metered dose inhaler and the other will be dry syrup preparation, and they will be given each day alternatively. That means one day you will have this, and on the next day you will have this. So either of these 2 can be your procedure in the prof exam. Okay, so what are the steps here? You can see the first step in metered dose inhaler is greetings. You have to greet the subject or the patient. So first of all, say Assalamu alaikum or Namaskar or Adab or good morning, okay, according to your religious belief. Now then you have to introduce yourself. For example, I am Muhammad Yusuf, whatever your name is, a 4th year medical student. I will show you how you will use this device or inhaler. Okay, the next step is holding. Then shaking, cap removal, then deep expiration, keeping your mouth closed, administration and deep inspiration, and then cap closing. I will not get into the details of these steps because I have already uploaded a video demonstration of these stations, so you can have a look at these videos so that you will be very much able to understand all of these things very clearly. Then dry syrup preparation. About dry syrup preparation, of course, the first part is same, greetings, salam or namaskar or adab or good morning. Then sample identification, you have to identify the sample here. Here you have to tell the generic name of the drug which will be written on the bottle. Usually the drug will be an antibiotic. Then shaking, cap opening, adding water according to direction, closure of the cap, shaking, instructions and preservation. About preservation, you have to say that you can preserve this syrup up to 7 days in room temperature and up to 14 days in a refrigerator. This is the advice about preservation of the drug. Now come to the interpretation part, which you consider as the most complicated part. However, it is not. Interpretation means what you see here in this graph, and you have to write down the things. Okay, you do not have to do anything out of the box. You just have to see this graph and you have to tell the examiner that what are the things, or write down in your paper that what are the things you see. That's it. Okay, now let's look at the first graph. Okay, the first graph is about plasma half-life. You can see here the first graph is about plasma half-life. So a graph will be given from general pharmacology. These graphs will always be from general pharmacology and you have to interpret the data. Okay, now you can see the graph here. Here you can see, although this is not very clear, this graph, however I think you can read that on the x-axis it's written time, that means half-lives. Okay, and on the y-axis here is the concentration of drug. Okay, so these are the time: 1 hour, 2 hours, 3 hours, 4 hours, 5 hours. Okay, and here is the concentration. Okay, milligram per ml, or microgram per ml, whatever it is. So let's see here. This is a graph. You will have to write down that this is a graph showing the relationships between drug concentrations and plasma half-lives. So relationship between drug concentrations, which is on the y-axis, and plasma half-lives, which is on the x-axis. Now after IV administration, the drug immediately reaches its peak plasma concentration, which is 1 microgram per ml. See here, here is 1. Okay, so after IV administration, you know that after IV administration the drug reaches the blood or plasma immediately without any delay. So it reaches the peak plasma concentration at the time of administration. That means at 0 point. Okay, you can see here that at point 0 here it reaches its peak plasma concentration here, 1 microgram per ml, and after that the plasma concentration will decrease with time, which has been shown here. Now let's see. After 1 hour, this concentration is reduced by half to 0.5 microgram per ml. Here you can see that after 1 hour this has reduced to 0.5 microgram per ml. That means it has become half. Okay, then after 2 hours the drug concentration is further reduced by half to 0.25 microgram per ml. Here you can see that after 2 hours it has become 0.25 microgram per ml, and after 3 hours the drug concentration is further reduced by half to 0.125 microgram per ml, and after 4 hours the drug concentration is further reduced by half. That's it. You do not have to come to any conclusion here. Just interpret the data. That means what can you see here? You have to write down that thing. Okay, you see these things, you write down these things. That is so simple. All right, now let's go to the next one. Relation between drug dose and response. Now, what is the relation between drug dose and response? You can see here drug dose on the x-axis and response on the y-axis. Okay, so drug dose means these things, how much amount of drug you are giving. Okay, maybe you are giving 5 milligram here, 10 milligram here, 20 milligram here, 40 milligram here, like that. Although here is no marking, the marking should have been here, but unfortunately it's not. And the height of these drugs represent their efficacy or their response, how much response they can produce. The maximum response is this. The height is the maximum response of these drugs. Okay, and these are the dose required to produce this response. Okay, so let's see. This is a graph showing the relationships between drug dose and its response. Okay, drug dose and its response. Here drug A, C and D have the same efficacy. Why? Because their height is the same. For that reason they have the same efficacy. Okay, you can understand that. And look at here, the drug B has the lowest efficacy among them. Why? Because its height is the lowest among them. They have the same height, but it has a very much less. This height is very much less. For that reason, it is the lowest efficacious drug. And another thing is, here drug B is the most potent drug, followed by drug A, C and D. Now what do you mean by potency? Potency means the amount required to produce a certain effect. So drug B is the most potent drug. Why? Because the amount is required much less to produce this effect. This is the highest effect. Okay, maximum response of drug B. So to produce this effect, this drug is required much less amount, so it is more potent. And drug A is required this amount, slightly higher than drug B. Drug C, it is more than drug A and B. And drug D, it is the least potent drug. Why? Because the amount needed is very much high to produce this effect. Okay, once again, drug B produces this effect with much less amount. For example, this may be 5 milligram. For example, this may be 5 milligram. This may be 10 milligram. Okay, this may be 20 milligram. For example, don't write these things in your answer script. So drug B is more potent, or the most potent, because it is required the least amount to produce its maximum effect. Drug A is required more than B to produce that effect. Okay, drug C is required much more than drug B and A, and drug D is required the most in amount to produce its maximum effect. So this is the least potent drug. So here you can say that drug B is the most potent drug. Okay, then drug A, then drug C, then drug D. So this is their potency serial, okay, and same. Now let's go to the next one. Relation between agonist and antagonists. Okay, now you can see that here we have plotted the agonist concentration here and agonist effect on the y-axis, concentration on the x-axis and effect on the y-axis. Now we have to see the relation between agonist and two types of antagonists. Here is the competitive antagonist and here is the non-competitive antagonist or irreversible antagonist. Now what is their relation? See here that agonist drugs show full response, Emax. This is the Emax. Okay, this is the Emax. They show full response without any antagonist. If there is no antagonist, then the agonist shows full response. Agonist shows Emax. That means maximum efficacy. And in the presence of an antagonist, they show submaximal effect. Their efficacy is lowered. Okay, their efficacy is lowered. Now come to competitive and non-competitive antagonist. What can we see here? We can see that in the presence of a competitive antagonist, the efficacy is lowered, but if you increase the concentration of the agonist drug, you can produce the similar efficacy. How? You can see here that this response, this height and this height are the same, right? This height and this height are the same, but to produce this efficacy or this amount of response, we have to give much less amount of drug. But if we want to produce the same efficacy, we have to give much more amount of drug. That means agonist. Do you understand this? So in the presence of a competitive antagonist, if you increase the dose of the agonist drug, if you increase the dose or the concentration of the agonist drug, then you can produce the same effect. Okay, so what you will have to write? You will have to write that in competitive antagonist, high agonist concentrations can overcome inhibition by a competitive antagonist. So a certain efficacy can still be achieved by increasing the dose of the agonist. Okay, but here in case of a non-competitive antagonist, increasing the dose of the agonist will have no effect. Okay, so you will have to write that an irreversible or non-competitive antagonist reduces the maximal effect the agonist can achieve. Increasing the dose will not have any effect on drug efficacy here. So an irreversible or non-competitive antagonist reduces the maximal effect the agonist can achieve. Increasing the dose will not have any effect on drug efficacy here. That means in the presence of a non-competitive antagonist, you will always have this flat line. Okay, this flat line. However, increase you do here in the concentration of the agonist drug, the maximum efficacy will not increase. This will remain here. Let's go to the next graph. Determination of potency, very easy. Here you can say the drug dose and drug response. Dose on the x-axis, response on the y-axis. The question is which of the two drug A or B is more potent and why? So that's very easy. You can see potency is the amount of drug that is needed to produce a certain effect. Now you can see that drug A and drug B has the same efficacy. They have the same height. Okay, so they have same efficacy. Now drug A needs 10 milligram to produce this effect and drug B requires 25 milligram to produce this effect. So which drug is more potent? Of course drug A is more potent because less amount is needed to produce its maximum efficacy, and drug B requires 25 milligram, that is more than 10 milligram. Of course you can understand that the 25 milligram it is required to produce this effect. So drug A is more potent than drug B. So drug A is more potent than drug B because here drug A needs only 10 milligram to produce maximum effect, where drug B needs 25 milligram to produce the same amount of effect. Okay, now come to determination of efficacy. It's also very easy. You can see the height of these drugs. The height implies the efficacy of the drugs. So drug B reaches here and drug A reaches here. So drug A is more efficacious than drug B, certainly. What about potency? Potency is the same. They both require 10 milligram to produce their maximum effect. However, drug B reaches up to here. You know, this is 50, this is 100, and it is somewhere between 50 and 100, so about 75% maybe. So this is its maximum effect, and you know the A reaches 100%. So it is much more efficacious than drug B. So drug A, the question here is which of the two drugs A or B has more efficacy and why? So you can say that drug A has more efficacy than drug B. You have to write down like this, that here drug A is more efficacious than drug B because with the same amount of dose drug A produces 100% response, whereas drug B produces only about 75%. Okay, so that's all about the interpretation station. Now let's come to prescription criticism. You will be given a prescription like this and you have to criticize the prescription. Okay, this prescription criticism. We have to consider three aspects in order to criticize a prescription. So what are these three aspects? You know already. These are format, legal aspects and ethical aspects. You have to criticize the format. That means particulars of the doctor is present or not, date mentioned or not, particulars of the patient written in proper position or not, and medicine. The medicine will be in block letter, generic name, strength, route of administration. These things are present or not. Let's come to the legal aspects. The name of the medicine in generic name or not, dose and frequency written or not, registration number of the physician is present or not. These are legal. Then ethical. Particulars of the doctor, name and address, particulars of the patient, name, age, sex, address, medicine, generic name and block letter. If there is any mixture of language, clinical findings mentioned or not, advice mentioned or not, registration number of doctors present or not, blood group for pregnant and going to have surgery patients. Okay, so yes, this is understandable that all of these points cannot be written in this short time, that means in your OSPE, but you have to mention the main points. Okay, so format, legal aspects and ethical aspects. How many numbers, or whatever points you can remember or you can write down in that short period, you have to write. Okay, maybe you will write 2 points from here, from the format, 2 points from legal, 2 points from ethical aspects. Okay, like this, 2 or 3 maybe, that will be enough. Now let's come to the drug formulation. You will be given a drug and you will be given some questions along with that. For example, here you can see ORS, oral rehydration salt. The questions will be, identify the formulation. You will have to write, this is a plastic sachet containing ORS. This is a plastic sachet containing ORS. Then the next question will be, write its composition, and the composition will be written here, okay, on the surface of this sachet. So you do not need to memorize this. This will be written here. You can see and you can copy here. The next question will be, mention its clinical uses. Do not write 5 or 6 clinical uses. Okay, just write down these 2 points, diarrhea and mild to moderate dehydration. That will be enough. Okay, this is an OSPE exam. This is not your written exam that you will have to write a long essay. Okay, this is OSPE exam. Just write down 2 or 3 most important points. Okay, then come to the next device. A device identification will be there. So this is pen-fill insulin, you can see. So you will write pen-fill insulin. The device's name is pen-fill insulin. Advantages of this route. Okay, the next question is advantages of this route. You will have to write that this drug is administered through subcutaneous route. The advantages of this route includes, what are the advantages? Slow and sustained absorption. Patient can be trained to administer the drug by himself or herself. Less chance of hemolysis or thrombosis. Then write down 3 disadvantages of this route. What are the disadvantages? Not suitable for emergency use, may be painful, and large doses cannot be given. Okay, these are the disadvantages of this route. Next drug, oral contraceptive pill. You will be given this this packet, you can see, and you will have to identify this formulation. So this is a blister pack containing oral contraceptive pills. This is a blister pack containing oral contraceptive pills. Then write the beneficial effects of this drug. What are its beneficial effects? Lower risk of developing endometrial and ovarian cancer, reduced menstrual blood loss and associated anemia, prevents premenstrual tension, dysmenorrhea and menorrhagia, prevents fibrocystic breast disease and ovarian cysts. Now look, here I have mentioned 4 points. You do not need to write all these 4 points. You can write 2 or 3 points, okay, because there is a time constraint. So don't go for all these points. Why are brown pills added to it? You can see the brown pills here. Okay, you can see the brown pills. These are the brown pills. I think you know the colors. These are the white pills. So the question is, why are brown pills added to it? The answer is continuation of drug intake and prevention or correction of anemia. because the women they sometimes forget to take the drug. Okay, because if you give this 7 days break, they will forget when to restart their pill, their active drugs. Okay, so this is given for continuation of drug intake, and also it can prevent or correct anemia if it's there. Now let's come to vial. Identify the formulation. This is a vial containing hydrocortisone. Okay. Now what is a vial? The vial is the the fat one. Sometimes you get confused between vial and ampule. So vial is the fat one or the thick one, and ampule is the slim one. Okay, so this is vial, okay, and this is ampule. This is ampule. So vial is the fat one and ampule is the skinny one, okay, or the slim one. So mention 4 indications of this drug. So look at the question carefully. It says that mention 4 indications of this drug, not 4 indications of this formulation. They are not asking you to write down the indications of this formulation, that means IV formulation. No, they are asking about the indications of this drug, that means hydrocortisone. So you can write acute bronchial asthma, allergic reaction, adrenocortical insufficiency, rheumatoid arthritis, dermatitis. We use the topical preparation in dermatitis, of course. Then mention 4 different routes of administration of this drug. Means hydrocortisone. In which routes we can use this drug or apply this drug? So intravenous, of course, it can be given intramuscular as well, intra-articular, in joint spaces, and topical as ointment. Next one, ampule. So you can see this is the ampule. The question will be identify the formulation and name the route of administration of this drug. So this is an ampule containing 2 ml atropine. The route is intravenous route. Then write clinical uses of this drug. For example, OPC poisoning, heart block, pre-anesthetic medication, etc. Mention the adverse effects of this drug. What are the adverse effects? Maybe dilated pupil, blurry vision, dry mouth, tachycardia, constipation, retention of urine, atropine fever, etc. Now come to this preparation, suppository. Okay, so identify the formulation and name the route of administration of this drug. So this is a paracetamol 500 milligram suppository. You have to write down its strength as well. Okay, paracetamol 500 milligram suppository. Mention the adverse effects of this drug. Okay, let's see it. Route is parrectal. Parrectal route. Don't write prerectal. It is not prerectal. Prerectal is not possible if you think logically. This is parrectal route. Okay. Mention the adverse effects of this drug. The paracetamol is one of the safest drugs, so it has very much less adverse effects, although it has a few: nausea, vomiting, abdominal pain, gastric ulceration, hepatitis. If you take in large amount, then you can have all these features. Write down the advantages of this route. That means advantages of the parrectal route. Can be used in case of vomiting. When a patient is vomiting, you cannot give that drug orally, so you can use this route. Irritant and unpleasant drugs can also be given. Can be used in unconscious patients. tablet. Okay, identify the formulation. Identify the formulation. This is a blister pack. Okay, you have to mention what kind of pack it is. So this is a blister pack containing ciprofloxacin 500 milligram tablet. You have to mention that this is a tablet or capsule. Okay. So this is a blister pack containing ciprofloxacin, the drug's name, its strength, and its formulation, tablet or capsule. Mention 4 uses or 4 clinical uses of this drug. 4 clinical uses of ciprofloxacin, maybe urinary tract infection, enteric fever, bacterial gastroenteritis, anthrax, TB, etc. It's a second line drug of tuberculosis. Name 2 other drugs of the same group. For example, levofloxacin, gemifloxacin, moxifloxacin. There are many other drugs as well. Now syrup. Identify the drug. So this is an amber colored glass bottle containing chlorpheniramine syrup. You can read the name here. This is a chlorpheniramine syrup. Mention 4 indications of this drug. This is a first generation classical antihistamine, right? So mention 4 indications of this drug. For example, allergic rhinitis, common cold, hay fever, pruritus, etc. Mention 2 advantages of the second generation of this drug over first generation. So 2 advantages can be longer duration of action, less sedative, etc. Now come to syrup. This is suspension. Okay. Identify the formulation. The first question can be identify the formulation. You will have to write, this is an amber colored plastic bottle containing antacid syrup. In bracket, write down suspension. Okay, this is the brand name, and here you cannot read this one. This is the generic name. Okay, you can write this thing from here. Just copy and paste here. Okay, so write down its composition. Sodium alginate, potassium bicarbonate, which is written here. This is the generic name or the composition. In case of generic name, you can write just this thing, antacid syrup. Okay, or if you like, you can write down the whole thing as well, your wish. But I think this is more efficient way to represent this. Now mention its clinical uses. What are the clinical uses? This is the easiest question, I think. Gastroesophageal reflux disease, non-ulcer dyspepsia, peptic ulcer disease for symptomatic relief, etc. Now let's come to capsule. Identify the drug. So this is amoxicillin. You can see this is a blister pack containing amoxicillin 500 milligram capsule. Okay. Mention its 4 clinical uses. Respiratory tract infections, urinary tract infections, meningitis, gonorrhea, enteric fever, peptic ulcer disease, in H. pylori eradication. Mention important adverse effects of this drug. Important adverse effects. For example, diarrhea and rash. Now, let's come to the clinical scenarios. You will have a station which will contain a clinical scenario. You will have to write down the treatment of that scenario. Okay. Now see here, write the drug treatment only. Okay. You do not need to write the general measures. You don't need to write that you will have to exercise regularly, you will have to avoid salt intake, you have to avoid smoking, alcohol, etc. These things are not needed here. You will have to write only the drug treatment. Okay. Then dose and duration will increase your marks. However, don't give unnecessary importance in this dose and duration. Okay, if you cannot remember the dose and duration, that's fine. If you can remember, that's better. Okay, write the treatment according to the scenario, and write the treatment according to the scenario. The clinical scenarios may be most of the time of these categories. Hypertension, you may be given a scenario of hypertension, you'll have to write down the treatment of hypertension, or maybe diabetes, enteric fever, bronchial asthma, UTI, acute migraine, chronic migraine. So you have to learn the treatment options or treatment of these diseases. Okay, so I'm not getting into details of these scenarios. Okay, you will have to identify, you will have to diagnose the disease, and you will have to write down the treatment. Static questions, you will have some static, maybe one static question from term 1 and another from term 2. So let's have a look at some static questions from term 2. For example, categorize the antiemetics. If this question comes in your exam, just write down like this, because you don't have the time to categorize this according to their function, I mean the receptor selectivity. You can categorize their function or conditions of usage. This is a very simple classification, and this is very effective in your OSPE exam. So antiemetics can be categorized according to the conditions of usage. 1. Motion sickness, for example domperidone, metoclopramide, promethazine. These are for motion sickness. Then for morning sickness, cyclizine, meclizine. And for drug induced vomiting, ondansetron, palonosetron, etc. Another question, let's have a look at this question. Name the drugs used in H. pylori induced peptic ulcer disease. What are the drugs used in H. pylori induced peptic ulcer disease? Triple therapy. So antimicrobials like clarithromycin and metronidazole, or clarithromycin and amoxicillin, or metronidazole and tetracycline. Whatever combination you can write down here. Then one proton pump inhibitor is given. So these are given 12 hourly for 10 days, and omeprazole or esomeprazole, which is given 20 milligram 12 hourly for 6 weeks. Okay. Then name another question. Name the second line anti-tubercular drugs. Mention whom do we prescribe them. So second line anti-tubercular drugs like rifabutin, rifapentin, amikacin, ethionamide, levofloxacin, moxifloxacin, etc. There are other drugs as well. So we prescribe them to MDR-TB and XDR-TB patients. And there are other indications as well. I have just put down here these 2 indications. Another question may be, name 5 bactericidal antimicrobials. 5 bactericidal antimicrobials. Now look here. Don't write the group name. Don't write long-acting penicillin. Don't write cephalosporin. Don't write aminoglycosides. Write down the name of the drugs. Okay, for example, 5 drugs, that means maybe ampicillin, ceftriaxone, amikacin, ciprofloxacin, azithromycin. Okay, write down the name of the drugs, not the group name. Okay, this will reduce your marks, and this will give you the perfect mark. Okay, so write down the drug name. Another question here, name 4 broad spectrum antimicrobial agents. So same thing applies here as well. Don't write their group name, write down their drug name, individual drug name. Okay, ceftriaxone, ceftazidime, amikacin, streptomycin, etc. Cotrimoxazole is a broad spectrum antibiotic. So I think you have got an overall idea about your OSPE exam. If you have any question, you can comment on the comment box so that I can explain it further. Now, one thing is that these are not the exact questions you will find in your exam. Maybe you can find these things. Of course, metered-dose inhaler, dry syrup preparation, these are the constant portion of your exam, but the questions like I have discussed here, the static questions, they may change. Okay, the static questions may change. You can find some other questions as well, but that will be from your reading. I mean, you have prepared for your Viva exam, so this type of questions, name of a few antimicrobial agents will not be a problem for you. Okay, you will not have to prepare separately for these questions, these static questions. That will be very easy questions, so you don't need to panic about that. And some questions may be directly from here. You can find these questions as well. And the clinical scenario, you'll have to prepare this thing. So I think you have got the idea, and now you will not have to panic during your OSPE exam. Another advice is don't rush during your OSPE exam. Okay, you will have enough time to write down everything, so do not write essay type questions, essay type answers, sorry. Write down the most important points, 2 or maximum 3 points. Okay, if the question asks you name 2 other drugs, don't write 5 drugs, write down just 2 drugs. That will save you time, and that will be appropriate, that will be the appropriate answer. If you write 3 or 4 when the question asks for 2, this will not increase your marks, and unduly this will produce annoyance in the examiner's mind. Okay, if the question asks for 4 clinical uses, write down 4 clinical uses. Here do not write 2 or 3, because that will reduce your marks. Follow your question. Okay, and of course write down these things. What kind of pack is this? Blister pack. What is the generic name of the drug? What is the strength? Okay, either tablet or capsule. You have to mention all these things. So don't rush, don't panic. I wish you do well in the OSPE exam as well as your traditional exam and Viva exam. So that's it for today. Goodbye.